as we begin the last section in the book, we're going to look at things like rehabilitation, deterrence, but we're going to start by looking at how do we know if a policy or program is effective in either controlling or preventing delinquency. So the best method of determining this is a randomized experiment. And hopefully what we will be able to do is compare levels of delinquency before and after participation in the program. Sometimes we compare delinquency levels of juveniles in treatment and with a comparison or control group. What we would ideally do is randomly assign people to ensure that those in each group are roughly identical to each other. And then the success would be determined whether or not juveniles in the treatment group have lower levels of delinquency than those in the control group after the treatment ends. We also want to remember that we know two things can appear related and may be related, but it doesn't mean there's a causal relationship there. So first we want to ask ourselves, is there an association between the two items? We have to make sure it's not due to chance. So there we're testing, if you've taken statistics already, we're testing to see if it's statistically significant. We also have to check though to make sure it's not due to a third party variable. And finally, the cause has to come before the effect. So why is it important to do randomized experiment? Well, when we look at scared straight type programs, these before and after studies found offenders experienced reductions in delinquency after the program ended. Researchers using randomized experiments found offenders in the control group experienced reductions in delinquency as large as program participants. So the experiments were not the cause of the reduction in delinquency. If we fail to properly evaluate programs, we can make incorrect conclusions about that. Unfortunately, program evaluations often have little effect on the extent to which a program is actually used. Policymakers and people in the general public probably aren't aware of these evaluations. Evaluations are sometimes ignored because people believe the program is effective. Take, for example, Scared Straight or DARE. And politicians are also reluctant to take action because some of these programs are supported by powerful groups. There's problems with randomized experiments, though. Sometimes individuals violate random assignment. Participants may fail to complete the program. And we often measure delinquency in terms of arrest rates, but we know that not everybody gets arrested for every crime they commit. It can also be difficult then to take those results and assume they apply to other juveniles or other settings. But more importantly, it's really hard to do a random experiment with humans. There's ethical issues and practical problems. So why are some programs ineffective? Well, the most obvious answer would be the program doesn't work. But sometimes a program looks one way on paper and it's not actually being implemented that way. Maybe it's given to the wrong group of kids, maybe they're not providing appropriate services, or perhaps the staff are not properly trained. So we have to look then at whether or not it's an issue of the program working or is it the way the program is implemented. And we can do this with process evaluations. So one thing we can do is non-randomized experiments. And these are an alternative to a random experiment. So we can do non-equivalent control groups. We can create a control group that is similar to the treatment group and try to match them on all the relevant variables that we think could impact delinquency. We can also do a time series design, so we can measure someone's delinquency before and then after a program takes effect. But we also know that third-party variables may be playing a role there. So let's look at the program Big Brothers Big Sisters. They have used, another agency has done extensive research on them. So their vision is successful mentoring relationships for all children. And it's to help children reach their potential through professionally supported one-to-one relationships. And they have set out to serve 1 million children by the year 2010. Sorry, this is data from before 2010. So it was hypothesized that participation in Big Brothers Big Sisters would result in some or all of the following impacts: reduced antisocial behavior, improved schooling, better relationship with family and friends, a better self-concept, and social and cultural enrichment. So the effect was determined by studying two randomly assigned groups of 10 to 16-year-olds who applied to the agencies during the intake period. One group of applicants, the randomly selected control group was put on the waiting list for 18 months. Case managers attempted to match the others, randomly selected. And then they were compared at follow-up. So Public-Private Ventures is the agency that has assessed this, and they found that little brothers and little sisters are 46% less likely to begin using illegal drugs, 27% less likely to use alcohol, 52% less likely to school, and 37% less likely to skip class. They were more confident in their schoolwork and reported getting along better with their families.